For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back, and we have a caller on the line. Good morning. You're on the radio.
Hello. Good morning.
Good morning. You're on the radio. How are you today?
Oh, goodness gracious. I'm well, thank you.
What's your question?
My question is, I have my sister-in-law who has having difficulty with a brain tumor.
I'm sorry to hear that.
Yes, indeed. Thank you. She's had surgery 3 years ago. Was somewhat in remission, and it returned again, and had surgery, and they claimed it was okay. Now it's back again.
Well, this is the kind of work we do, and we'd have to see the scans and so on, but we were the first ones in New York to perform radiosurgery and fractionated radiosurgery for brain tumors, both benign and malignant brain tumors.
Okay. What they propose now is to give her some sort of helmet, and to change some of the chemo, and she's distraught over that. And I've been listening to you for a long time because I'm up early, and very interesting, and now is the time, I think, to have her turned over to you with her husband, my brother, and perhaps you guys can perform a miracle and split the Red Sea and have her walk into freedom.
Well, I tell you, I would try to avoid that helmet. The helmet you're talking about probably is a gamma knife, which screws on in the head. So number one, it's painful. Number two, it's technology that's not, I believe, the best for brain tumors because it doesn't allow us to divide up the dose. We know from studies over many years that if we can divide up the dose even to a few fractions of treatment, it's safer. So our technology is fractionated radiosurgery. That helmet-style treatment we abandoned in 1993. So 21 years ago, we stopped it. I don't think it's current technology. I think it's painful and antiquated and harms the healthy surrounding brain. So, yeah, give us a call at the same number you just called, 212-CHOICES. We have a booklet and DVD which we'll send out, but best is to meet in person.
All right, then I will certainly turn over the number to my brother and her and have them give you a call and hopefully everything will be wonderful for them.
All right. God bless you and stay in touch.
Thank you so much for your service.
God bless you and stay in touch. Bye-bye now.
Thank you. Bye-bye.
Okay, and we're actually going to talk about another brain tumor, a benign brain tumor, a pituitary tumor. We had a 57-year-old man come in this week, and in 2008, all his normal function, sleeping, blood test, sexual function, stopped. He had no erections, no libido, and tests showed that he had a large pituitary tumor. So pituitary is kind of the master gland. He had a tumor that was wrapped around the chiasm, which is the main nerve for vision. He saw multiple neurosurgeons, and he declined neurosurgery. I think that was a good decision because the tumor was wrapped around the chiasm, which is the main vision nerve. And when that's manipulated, often patients lose vision, and we've certainly seen that happen repeatedly. This tumor is invading the cavernous sinus and prepontine cistern. So, again, we've actually just updated our data for pituitary tumors, and the vast majority, let's say 98% of pituitary tumors we treat with radiosurgery, fractionated radiosurgery, which is a non-invasive method, no cutting, no bleeding, outpatient therapy. Each treatment takes about 15 minutes. Has a very high success rate, avoiding that surgery and avoiding that damage to the healthy critical structures like the vision nerves, the chiasm, and the optic nerves. So, yes, we treat many, many brain tumors. It's a non-invasive technology. And as I say, we were the first in New York with fractionated radiosurgery. Ours avoids the screws in the head, the pain of that, and the single fraction, which has probably the most complications, which we're trying to avoid. We had a man who came in yesterday with a Gleason 6 cancer. He's a Hispanic man, 63 years old, born in Puerto Rico with prostate cancer. He was diagnosed, strange case, he was diagnosed a year ago with a Gleason 6 cancer. So Gleason 6 tells us an intermediate grade cancer. And he was sent to a place in Long Island for treatment. He lives in Brooklyn, and he said, I don't want to go there. And the doctor says, well, no one else will treat you except this place. So it sounds like maybe the doctor was getting a little bit of grease on his palm, although I didn't see it for a fact. And then the doctor didn't give him his pathology. It took us 2 hours yesterday to get the pathology. We finally found Gleason 6. And then the doctor did another biopsy, even though he already had a biopsy showing cancer. So it didn't exactly make sense to me. He had a biopsy a year ago, showed cancer. He was sent to someplace far in Long Island. He was told there's no place in New York City that treats prostate cancer. The patient was really upset about it. He felt that the doctor wasn't being honest, and patients are smart, and patients sense when something is fishy. He wondered why he was getting a second biopsy when he already had a biopsy showing cancer. He wondered why he couldn't be sent to us. He heard about us from his friend who was successfully treated with prostate cancer, treated here with radiation. So it's an interesting case. If you have questions or concerns, call us or come in. Let us help explain or understand the case with you. We'll get the documents. Like in this man, we will give you a copy of the pathology. You'll walk out understanding what's going on, given options. We, again, have most insurances accepted, Medicare, Medicaid. We'll give you the paperwork. We'll give you the time of day. You are our boss. You are the president of the United States of your body when it comes to us. So you're welcome to call us during the week for that booklet and DVD. We're at 212-CHOICES, 212-246-4237. My name's Dr. Lederman. We have a whole staff dedicated to you. We're centrally located in the midst of Manhattan by most subways, trains, buses, Grand Central, Penn Station, PATH train, Port Authority. So give us a call, and we promise not to make you wait. Our goal is to provide you all this information. If you have questions, just call me at 212-CHOICES. Thank you for listening today, and God bless you. Talk to you tomorrow on WOR. We have 4 programs.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation, and it just didn't work or didn't get the desired effects. All of a sudden, you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York. A Cumulus station. 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 A Cumulus